ECHO TV is a co-production of Minnesota's Emergency and Community Health Outreach Collaborative of health, safety, ethnic and nonprofit agencies, and TPT's Minnesota channel.
Hello and welcome to ECHO, which stands for Emergency Community Health Outreach. I'm your host, Lillian McDonald, the Executive Director for ECHO. This program brings you health and safety information in multiple languages, this version, of course, in English. Our topic this time, preventing seasonal flu. We'll have a guest expert, but before we get started on our discussion, we'd like you to watch this.
This ECHO show is about the flu, which is also called influenza. Flu has different names in different cultures, but anybody, anywhere can get it. In Minnesota, the flu season usually starts in November or December and may last until early spring. You usually get the flu from other people, and you get sick pretty fast. You may have a dry cough, a sore throat, a fever, or a headache. Your body may ache, and you may feel very tired. The flu is kind of like getting a cold, but you usually have a fever and feel a lot sicker. In America, you will sometimes hear people talk about stomach flu, but if it's really the flu or influenza, you won't have vomiting or diarrhea. Most people get over the flu, but it can interrupt your life for a week or even longer, and for some people it can be very dangerous, especially if you're very old, very young, or if you have other health problems. One way to protect yourself is to get a flu shot, but you have to get a shot every year because the flu changes from one year to the next. There are ways to take care of yourself if you do get the flu. Get lots of rest and drink plenty of liquids. Avoid alcohol and tobacco. Use medicines you can get from the drugstore to make yourself more comfortable, but don't give aspirin to children or teenagers who may have the flu. That can be dangerous. There are also ways to keep from giving the flu to people around you. Cover your nose and mouth with a tissue or a sleeve when you cough or sneeze. Keep your hands clean by washing them with soap and water or using a hand sanitizer with alcohol in it. There's also one more thing you should know about. Usually the flu only changes a little bit from year to year. But every few years, maybe once or twice in a lifetime, the flu can change in a very big way. When that happens, the flu can be very, very dangerous for everyone, not just older people or people who have health problems. For example, you may have heard about people in Asia who've been getting a very dangerous type of flu from turkeys, chickens, and other birds. Right now, people can only get this kind of flu from birds, but not from each other. But that could change. If it does, we may have to be ready for a new, more dangerous and deadly kind of flu. Public health officials will be watching this situation very closely, and we will be ready to help you protect yourself if it ever becomes necessary. Flu is an important health concern for everyone, and we're going to talk about it today on ECHO.
You're watching ECHO, Emergency Community Health Outreach. I'm Lillian McDonald. We appreciate you watching this program on preventing seasonal flu. And joining me to talk about this subject is Chris Ersman from the Minnesota Department of Health. Thank you very much for joining ECHO. We appreciate your expertise.
Glad to be here.
We appreciate this. And tell us a little bit about your background and what you do at the Minnesota Department of Health so folks have an idea of who you are and how you fit into the subject matter.
Well, I have a background both in nursing and in epidemiology. I have a graduate degree in epidemiology, and I came to the department as an epidemiologist, but now I oversee the state's immunization program, the TB program, and the refugee health program. So kind of a broad area, but included in that is both influenza vaccination and surveillance for influenza.
And influenza being an infectious disease, so it kind of fits right under your branch.
Mm-hmm. Yes. Actually, influenza is caused by a virus. It's a respiratory illness that people tend to get in the winter months here in Minnesota.
All right. Well, let's talk a little bit about the flu and the basics. You know, it seems like simple, like, oh, it's just the flu, but it's really kind of a big deal.
Yeah, I think because influenza is seasonal and because it does happen every year, it's tends to get a little bit routine for people, but it does have the potential to be a very serious disease, both for young children and for older individuals, as well as for individuals who have chronic health conditions. So we don't want to take it lightly.
Too lightly. Yeah.
Right.
Across the country, how many deaths do we have because of just the basic seasonal flu?
Seasonal influenza accounts for about 36,000 deaths nationally in the United States.
And when you're talking about older people who may be more susceptible to the flu, what age are we talking about here?
Well, I think most people are familiar with the 65 and older age group, but actually influenza vaccine is recommended for individuals 50 and older. So I guess as I'm getting older, I hate to say that 50 is older, but actually, if you're 50 and older, you really need to consider getting an influenza vaccine.
And you were talking about people with chronic health conditions should also get a flu shot. What do we mean by a chronic health condition?
Well, if somebody has a heart condition, lung disease like asthma or chronic obstructive pulmonary disease, something like that. If you have high blood pressure, diabetes, any of those kinds of conditions would make you a good candidate for receiving the influenza vaccine.
And most likely because your immune system is a little bit worn down, or because of your pre-existing condition, you're more likely to catch the flu.
Absolutely, so, and also have complications if you do develop influenza.
Okay. When does you said the flu season gets started in Minnesota about what, October, November then?
Right, we can't actually predict the pinpoint the absolute beginning of it, but generally we consider the influenza season to be October through May in Minnesota.
Mm-hmm. And you know, I have to ask this question just because some people believe this, but you know, we live in Minnesota here, and this program is being recorded in Minnesota, but some people think that because it's colder here, that there's fewer germs here in the wintertime. Can you speak to that at all?
Well, actually, it seems like there's a correlation between temperature and influenza, because obviously in Minnesota it's cold when flu hits. But if you think about Florida, they're having their influenza season at the same time that we are in Minnesota, and their weather is a lot nicer than ours. So it's actually not related to the temperature, although it seems like it should be, because it does run over those October through May months.
I know some people think that if you just open up the windows or go outside, you'll be able to kill all those germs, but that's not true. You should probably bundle up.
That's right, keep warm.
You're talking about children too with the flu, and I know there was a particular year of recent time where we had quite a few children who died of the flu. Can you speak to pediatric care around influenza?
Well, thankfully, pediatric deaths are fairly uncommon. However, during the 2006-2007 influenza season in Minnesota, we had 6 deaths in children from influenza. And that really emphasizes, again, how important it is for children to be vaccinated. Because even though influenza is seasonal, it does come every year, it can be very serious, even for healthy children. So we do recommend that children who are from 6 months up through 59 months, or basically up through 5 years of age, be vaccinated. But anybody who wants to avoid getting the flu should be vaccinated. All children can be vaccinated.
Is it always a shot or vaccination for children, or is there another way they can get the vaccine?
There's a new vaccine that is called Flu Mist, and it's actually an intranasal vaccine. And so it's given in the nose. It doesn't involve a needle, and that can be given to healthy people age 5 through 49 years of age.
Now, I have to ask this question because, again, maybe it's a myth, but, my folks, I try to encourage them to get a flu shot, and I know my father has said to me before, last time I got a flu shot, I got sick. Can the flu shot make you get sick?
No, actually, it can't. It's actually a killed vaccine, so it cannot give you the flu. I think what confuses people is, because flu is a term that we use for everything bad that happens to us, including what people refer to as the stomach flu, which is vomiting and diarrhea. I think sometimes people get confused. I've had people tell me, yeah, I got the flu shot and I got the flu afterwards, and they were vomiting and things like that. So one reason that people might be confused is because they misunderstand what influenza really is. It's respiratory. And then the other thing is that sometimes people are actually already incubating the flu. So they've already been exposed, they get the flu shot and develop influenza. I can tell you that if you've been vaccinated and you would develop influenza later in the season, it will be milder.
So getting a flu shot anyway, you can still get the flu, you just have fewer symptoms.
Right. The flu shots are very effective in protecting against flu, but one of the things that we have to consider is that we're trying to match the strains of influenza that are provided through the vaccine with what we expect to be circulating. And for the most part, there's a very good match. But if it's not perfect, you could develop influenza. But the bottom line is that you'll have a much milder version of flu.
And that's kind of the challenge, isn't it? I mean, every year epidemiologists are studying the exact strains, and you're storing that information for next year's flu vaccine.
Right. You know, when people think about getting flu vaccine, they're thinking about it in the fall of the year or November, December.
Yeah.
But actually, if we think ahead to the upcoming flu season, they've already started working on that in January and February of the year before, determining what strains to include in the vaccine and beginning the manufacturing process.
And there's always enough flu shots to go around, by and large, for the most part, and that's why we want folks to go out and get a flu shot. But, you know, and we've talked about how helpful they are. Is it helpful if you've had them annually over time, or will it make a difference if this is my very first flu shot?
Even if it's your very first flu shot, you will have protection for that season. For children who are 9 and under who have not had a flu shot before, the recommendation is that they get 2 doses, and that's simply because their immune system hasn't really been introduced to influenza like we have as adults, and so they need the 2 doses to kind of prime their system or boost their immune system.
When do they get the 2 doses then?
They're a month apart.
Oh, okay.
But for adults, if you haven't had a flu shot and you get one this upcoming season, doesn't matter if you haven't had one before, it'll still offer you protection.
Okay, good to know. Where do we get them?
Well, you certainly can go to your healthcare provider. That's an excellent place to receive a flu shot, and many healthcare providers offer walk-in clinics or really kind of ramp up their vaccination efforts in preparation for flu season. But we also see influenza vaccines being offered in grocery stores, at pharmacies, lots of what we consider to be non-traditional community sites. You can also receive a flu vaccine.
And the quick clinics that you see in the malls now?
They also offer influenza vaccine, and they're all excellent places to receive a flu shot. I guess it's wherever you're comfortable getting vaccinated. And the cost is variable, but certainly public health and other venues offer low-cost vaccines, so cost should not be an issue for people.
Typically it's about, what, $20, $25?
Right, if you have to pay out of pocket.
And some insurance companies will provide the coverage for that cost for once a year flu shot. If you have insurance, that will cover that. Otherwise, sliding scale is available.
Right. Often clinics will have a sliding fee scale, and there have also been free clinics that have been offered in some communities. So I think if you're concerned about getting a flu shot, you can contact your local public health clinic. The Department of Health has a website that also provides information on where clinics are. We want people to be vaccinated, and we certainly don't want cost to be a factor.
Because we're talking about prevention here and the best remedy for that. There's going to be a laundry list of symptoms here. So we should probably talk a little bit about the respiratory symptoms and the differences between that and stomach flu again.
Right. Influenza as a respiratory illness has a very rapid onset. People often say that they feel like they've been hit by a Mack truck, so they kind of know when it happens. And the symptoms that people have are fever, aches, headache, muscle aches, cough, that kind of thing, just generally feeling quite rotten.
There can be milder forms of the flu then, because I know I've felt bad having the flu, but some people have told me they have really had it, can be out for days.
Right, it can be very significant, and as we've talked about, people can be hospitalized, and certainly people die from influenza. In general, it's a pretty severe illness where you're feeling pretty rotten. I think sometimes people can have also very severe respiratory illnesses, and so it can be easy to kind of, they're all happening about the same time. But in general, I would say if you had something with a rapid onset, fever, body aches, muscle aches, and you just feel like you don't want to do anything, that's very likely influenza.
Now, let's talk a little bit about prevention too. You don't really know you have it until these symptoms start showing up, but you're probably contagious beforehand?
Yeah, you are contagious before you develop symptoms, but clearly there are things you can be doing all the time that can help you prevent influenza. One is certainly good respiratory hygiene, so if you do have a cough, if you cough into your elbow, that's a good way to prevent spreading flu. Washing your hands is the best way to prevent lots of things, and good hand washing involves, making sure that you're washing your hands for a long enough time period, and 20 seconds is kind of the time frame that people think about. And a lot of times people don't know how long that is. And if you can sing a song, happy birthday, row, row, row your boat, those are ways you can kind of pass the time in your head.
And you have to use soap and water. It's one of those things where it's the friction in your hands and combined with the soap and the water that's actually removing the germs. It can't just be sort of tossing your hands under the water and calling it good.
Being close to water doesn't count as washing your hands.
Okay, good. We should also say that this program, ECHO, brings you prevention and emergency preparedness information in multiple languages, and preventing the flu is one of our subjects that we offer in multiple languages. If you'd like information about it, you can go to our website, www.echominnesota.org. But as we continue this discussion in English now with our guest, Chris Ersman from the Minnesota Department of Health, I want to make a distinction between your routine seasonal flu and this pandemic flu discussion that we hear from time to time. What's the big difference?
Well, when we talk about seasonal influenza, it is an illness that covers the globe. We see it in all parts of the globe. But when we talk about pandemic influenza, we're talking about a worldwide epidemic in the sense that we have a new strain of influenza that no one has really been exposed to before. So it's new for everyone. And so as a consequence, they don't have immunity, and the consequences can be much more severe.
Okay, so we're talking about a lot more fatalities, a lot more illnesses, which is part of the work of emergency preparedness, to be prepared for that. And of course, individuals, families, and organizations like health departments and safety departments are working together on plans should a pandemic come. Will we know? Is this something that will just happen overnight, or is it something that just sort of rolls in over time?
Well, I think that everyone is sort of preparing for the next pandemic, simply because there were 3 pandemics in the last century, and we sort of anticipate that it's very likely that there'll be another pandemic in this new century. So it won't be overnight. On the other hand, I think that when a pandemic does occur, it will spread fairly rapidly, simply because of our excellent transportation systems. But local government, state government, federal governments are all working to prepare for pandemic influenza, so that will help us in terms of a response.
Great. Listen, I want to really thank you very much for joining us on the ECHO program with all this information. Is there one more thing you want to add quickly before we close our program?
Well, I really want to encourage people to take advantage of influenza vaccine, and they can start thinking about that in the fall, but it's never too late to get a flu shot. So if you didn't get one in October or November, you can keep trying. And then the other thing is that, any preparedness effort that you do is going to help you no matter what the emergency is, pandemic, blizzard, any of those things. So keeping prepared is always a good idea.
Thank you very much. Our guest, Chris Ersman from the Minnesota Department of Health on ECHO. We've talked about a lot of things, but we'd like to boil it down to basically 3 key messages on this particular subject. The first being, although most people become healthy again after they get the flu, it can be very dangerous, especially if you're older than 55 or if you have health problems. Number 2, you can protect yourself by getting a flu shot, but you have to do it every year. And number 3, to prevent yourself from giving the flu to other people, cover your nose and mouth when you cough or sneeze. Wash your hands often with soap and water. I think my thanks again to our guest, Chris Ersman from the Minnesota Department of Health, and thanks to you for watching this program on preventing seasonal flu. I'm your host, Lillian McDonald. You've been watching ECHO, Emergency Community Health Outreach. If you'd like more information about this program or others, please visit our website, www.echominnesota.org. Until next time, thanks for watching.
ECHO TV is a co-production of Minnesota's Emergency and Community Health Outreach Collaborative of health, safety, ethnic and nonprofit agencies, and TPT's Minnesota channel.